In your health, a new definition of autism could dramatically cut the skyrocketing number of people diagnosed with the disorder. As Mark Barger reports, it could also cut funding for educational programs and government support.
The number of children diagnosed with autism has skyrocketed over the last decade, with roughly 1 in 110 children said to have the condition. But that could change soon. The manual doctors use to guide them through an autism diagnosis, called the DSM, is changing the definition of autism, narrowing the criteria.
There is a group of people who are currently meeting diagnostic criteria who may not meet according to the proposed DSM-5 criteria.
Experts estimate half of autism patients who are high functioning, meaning they have normal IQs, would no longer be considered autistic under the new definition. Autism advocates say these diagnoses have real-world implications and that cutting out this group of high-functioning children would be cutting access to the aid they need.
Many times to obtain services, you have to have a diagnosis of an autism spectrum disorder. This might allow you to get early intervention or participate in a classroom that's specialized.
For men?
Yes.
Outside experts say while the list of symptoms used to diagnose autism will be cut down, it doesn't mean children who have the condition will be excluded.
The hope is that we have really refined symptoms to a point that this represents the core of the disorder and that this could be applied across that continuum from individuals who might have intellectual impairments as well as individuals that might have very, very high IQs.
The changes are still under review and won't be finalized until later this year. And experts say a new definition won't put a stop to the climbing rate of autism. There's been a 600% increase in cases over the past 20 years, and only a quarter of that is attributed to a better understanding of the condition. Mark Barger, NBC News.
Are you videotaping? Food dyes are just one thing dietitians suggest parents remove from their children's diets. And that's because food dyes have been tied to hyperactivity, and they've even been banned in parts of Europe. That's according to Kristin Kirkpatrick of the Cleveland Clinic. She also suggests avoiding processed foods.
Any kind of pre-packaged snack that you're getting out of a can or out of a package for your child is going to be really high in sodium. And some really interesting research is showing that if you can lower your child's sodium now at a very young age, it may help to ward off hypertension at a later age.
Kirkpatrick adds, avoid using fast food as a reward, skip soda, and water down sugary juices before serving them to your kids.